using a relational approach of working with people with these particular problems.
I think I've been at meetings, Ron, where you've talked about that we in JMFT you continue to get articles submitted to you that are training related, or that would really only be have appeal to maybe educators in MFT, not MFT at large, but even just educators. Is that, hopefully I'm not misquoting or misrepresenting that, but is that the case? I mean, do we tend to talk a lot of, I mean, we have doctoral programs that generate research, and our research is about our doctoral programs.
Well, there's two different kinds. We get maybe, and coding is, you know, how I code these things, maybe 12 to 15 of those of supervision, education, training papers a year. One is more the one-off. Here's what our students are struggling with, and the others have a tendency to be more. We've looked at AMFT competencies, and here's how we're moving in that direction. But those are rather. It's going to appeal to the other program directors in that. I don't necessarily see that that's being picked up by other educators. Although Len Sperry's done a really nice new book about competencies, and he looks at, he's on our board, he's looked at MFT, social work, counseling. So you're starting to see a little bit more of our stuff appearing alongside with those. But it becomes the tyranny of the page budget. You have so many pages in the journal, and you have so many articles that you can publish. And so we have talked about that maybe there's a different type of publication for that, but it could almost kill any academic doing it, because if it's not in a juried AMFT, we just have the one juried outlet, JMFT. A family therapy faculty member writing in Family Therapy magazine will not get that kind of credit when they get reviewed. So that's a real challenge. So as an organization, we're saying, I've been saying, maybe there's something we can get a proclamation out of the group that we're working with here at the University of Georgia as bringing everybody together, is maybe it's time to look at more pages, maybe it's time to look from going to a quarterly to bi-monthly, and to do that, because you'd hate to say we can't publish that anymore because we've taken that this is more important to our mission. JMFT is an omnibus kind of journal. It publishes everything. And even the readership, it's a struggle between folks like you who are the researchers, yet the bulk of the membership of the organization who get this journal as part of their benefits, it's their practitioners. So it's that balance of being able to have clinical research that translates well into the clinical practice.
Would you do you have any words of advice for people who are preparing manuscripts, professional manuscripts, and not necessarily just ones that would go into JMFT?
Right. There's sometimes an expectation that for students that a very well-written paper that had a nice score on a rubric in a course is ready to be submitted for publication. That's very rare. And so what I encourage the students to do is for my students, it may take a whole nother year after the course is over of working it and getting the writing level up to a level. So definitely working with more senior folks in your department, working with faculty. Sometimes you'll get the kind person who will read those sorts of things. Sometimes you can email an editor, and they won't necessarily read a whole paper, but you can present the abstract and the idea, and you can kind of get some feedback that way. But it usually will take maybe one or two revisions, and sometimes you just can't see what needs to be done to that paper. But it's very rare for that paper to be ready to go right out of the class feedback, because as a professor, I don't nearly have the kind of time to review. Like if you're a reviewer and you're getting one paper a month, you're going to put a lot more attention into that. So your paper deserves and needs that kind of scrutiny to help make it that process. Another strategy is to send it out and see what comes back. It just becomes a time factor. Should you have taken the 3 months or 4 months to get it in better shape, or send it out there and don't mind getting rejected, or those kind of things.
Are there, do you find that there are common misconceptions about people? I think one of the ones, when I talk about this one, comes to my mind is a person who says, well, I don't like writing for professional and a professional audience because it's too jargony, and I have never felt like professional documents that are published end up being too jargony, because I think it's a convention we want to get away from. I
agree. Our friend Mark White always says the reader's always right. if the reader says, I don't understand it, then it's not understandable. And certainly that kind of jargon is that kind of issue. And we sometimes, when you've written your paper, you've written with your culture and your coursework and your program in mind, and you have used a very specialized language, or it's used in a very specialized manner. And that's always the challenge. And when you send it to somebody, they can see, oh, I don't quite understand what you're saying. And that's always helpful, because I always tell the students, well, you wrote that paper with those ideas in mind. It's just not in the paper yet. And it's hard for you to see that it's not there. So despite, so getting, Carmen Knudsen-Martin says is that if the failure is the first step to success. And a good rejection is fine, because someone gave the time to honor your paper with criticism. And you have to learn to take that kind of, because a lot of our students have been the A students and they always do well, and it's hard to deal with that kind of feedback. And Carmen does a wonderful talk when we do each year at the annual conference. We've done a thing about writing papers, and she always closes, because she kills. She does a great job, and she just talks about that she says, when I submit the paper, I have to say, this is the best I can do now, and I hope that you could help me make it even better.
Yeah. Okay. All right. Thank you very much.
See, Carmen always kills. You always close with Carmen. It's great.
Close with your strong points.
Yeah.
All right. Anything else that you would add, Ron? Things that maybe I didn't ask about, but
No, I think that really covers it, because a lot of it's the misconception. And one of the things that students will say is that, well, I haven't seen this type of paper published in your journal. Do you publish those kind? I just had one person that said, do you publish papers? This was just this week on the self of the therapist. And I felt like saying, well, did you see that Harry Aponte thing we did, where it was all about the self of the therapist? But they were just looking in a particular manner. So I always say the editor can only publish those papers that he or she receives.
Yeah.
And so you can't take it that we don't publish a particular thing, or maybe people have written it and it just hasn't been to that level that we feel that it's publishable in JMFT. So, interacting with the journal, finding more about the journal, contacting editors. We're not all bad people like me. I mean, people are very friendly, and we'll talk to people about that. But you can't assume just because you've not seen it doesn't suggest that it's not honored, it's not privileged, or not wanted.
Appropriate to come into it. Yeah. Yes. Okay. All right. Thank you very much, Ron. Appreciate your time.